Do you often feel misunderstood or struggle with intense emotional experiences? It's a question that may resonate with many of us, but for some, it goes deeper than the occasional emotional roller coaster. We're talking about borderline personality disorder, or BPD, a psychiatric condition that's characterized by a pervasive pattern of instability in interpersonal relationships, self-image, and emotional regulation. It's a complex disorder that's often misunderstood, even by those who experience its symptoms daily. This is a journey into the mind, an exploration of the human psyche. We'll be delving into the 6 telltale signs of BPD, from the fear of abandonment to unstable relationships, unclear self-image, impulsive behaviors, self-harm, and emotional instability. Each sign, a piece of the puzzle, shedding light on this intricate condition. If you find yourself nodding to these questions, stay tuned as we delve into the 6 signs of BPD. The first sign of BPD is an intense fear of abandonment. This fear isn't just the normal worry we all have about being rejected or alone. It's a deeply rooted dread that those close to us will leave. It's like a shadow, always lurking, turning benign scenarios into potential abandonment situations. Imagine feeling a pang of panic every time a loved one is late, or when a friend doesn't reply immediately to a text. Or perhaps you find yourself clinging too tightly to relationships, smothering those close to you out of fear they'll slip away. This fear can be so consuming, it dictates your actions, thoughts, and emotions. It's important to remember that this fear isn't rational. It's not based on evidence that people are actually leaving. It's a manifestation of an inner turmoil, deeply ingrained, often stemming from childhood experiences. If you find yourself constantly worried about being left alone, this could be a sign of BPD. The second sign of BPD is unstable relationships. People with borderline personality disorder often find themselves in a whirlwind of relationships that are as volatile as they are intense. One moment they might be absolutely smitten, the next, they're consumed with negative emotions. This cycle, this constant ebb and flow of emotions, is a hallmark of BPD. Relationships aren't meant to feel like a tempest in a teapot. If your relationships seem like a roller coaster, this could be another sign of BPD. The third sign of BPD is an unclear or shifting self-image. This often manifests in individuals struggling to define their own identity. This internal battle can lead to an ever-changing landscape of goals and values, much like shifting sands. As they grapple with their own perception of self, their identity may seem to fluctuate, as if caught in a perpetual state of flux. This constant uncertainty can be deeply unsettling. If you often feel unsure about who you are, this could be a sign of BPD. The fourth sign of BPD is impulsive, self-damaging behaviors. This sign is often manifested through actions that can hurt oneself physically or emotionally. For example, reckless driving, which not only endangers one's own life, but also the lives of others on the road. Another example is binge eating, an act that can lead to numerous health problems such as obesity, diabetes, and heart diseases. Substance abuse, including alcohol and drugs, is another impulsive behavior often seen in individuals with BPD. These substances may provide temporary relief from the emotional turmoil, but in the long term, they lead to addiction and other serious health consequences. These impulsive behaviors are not random acts of recklessness. They are often misguided attempts to cope with the intense, overwhelming emotions that individuals with BPD experience. In essence, they are cries for help, desperate attempts to gain control over feelings that seem uncontrollable. If you engage in impulsive behaviors, especially when upset, this could be a sign of BPD. The fifth sign of BPD is self-harm or suicidal behavior. Now, this is a grave symptom that needs immediate attention. Individuals with borderline personality disorder often grapple with intense emotions they find difficult to regulate. This emotional turmoil can sometimes manifest in harmful behaviors directed towards oneself. These behaviors can range from minor self-harm, like scratching or biting, to more intense forms like cutting or burning. In some cases, the emotional pain becomes so unbearable that the individual may entertain suicidal thoughts or even attempt suicide. It's important to understand that these behaviors are not attention-seeking tactics, but desperate attempts to gain control over distressing feelings. Individuals with BPD may resort to such actions in a bid to numb their emotional pain, or as a way to physically manifest the internal distress they're experiencing. If you engage in self-harm or have suicidal thoughts, it is crucial to seek help immediately. This is a serious sign of BPD. The sixth and final sign of BPD is emotional instability. This is characterized by intense emotional swings, almost like a roller coaster ride. One moment, a person with BPD might feel euphoric and on top of the world, and the next, they could be grappling with feelings of intense sadness or anger. These emotional shifts can happen within a few hours or span across a couple of days. It's a whirlwind. If you experience intense mood swings, this could be a sign of BPD. Recognizing these signs is the first step towards understanding BPD. Fear of abandonment, unstable relationships, and unclear self-image, impulsive behaviors, self-harm or suicidal tendencies, and emotional instability, these can all be signs of borderline personality disorder. If they resonate with you, it's crucial to seek professional help. This is not a journey you have to walk alone. Remember, if you're experiencing these signs, you're not alone. Reach out to a mental health professional for help. It's never too late to start your journey towards understanding and managing BPD.